Hey guys, this is Greg with Medical Muscle, and in this video I'm going to talk about the resources that really helped me during clinical rotations. So I talk a lot about doing questions and things like that, and those really are more for the exams, the shelf exams and step 2, which are very important. You have to do well in those. But I think it's equally important to have good resources for your clinical skills as a student. I think a lot of people overlook that because part of what you're being judged on at the end of the rotation is your clinical skills. So I'm going to just go over a brief list of resources that I use that I found really helpful. So the biggest one, the most important one that you need to download on your phone the second you are able to do it is UpToDate. It's like the WebMD, but for doctors. It really goes into way more detail than any other resource I've seen go into. And it always references scientific papers, so you can look at those. And it's just really easy to use. You can get a free version of UpToDate if you're able to log in to one of the computers at the hospital. You can use their system and then get it on your phone. So that's pretty nice. You shouldn't have to pay for it. UpToDate is really helpful. I gotta say, it saved my life a few times. I remember we finished our table rounds and I had to do a presentation on, I can't remember what the topic was, but it was some topic that I was supposed to prepare for. And I didn't have a lot of time to prepare for this. Honestly, I was super busy. I was getting ready for the end of the shelf and doing a lot of studying. So honestly, I just sat there with my laptop open and I had UpToDate and I was just looking through and being able to discuss the topic that I was supposed to be researching. And it ended up being really good. So it's very helpful. Okay, the second app that I think is really helpful was WikEM, WIKEM. I'll put all these links down below. It was something I downloaded during my emergency medicine rotation, but I found it was really helpful for a lot of other rotations. It's not as in-depth as UpToDate, and it'll tell you like differentials that you should be looking at if this patient is presenting with things that are like this condition. Other things that you should keep on your radar, the medications that are used to treat that condition, dosages that you should maybe be using. It's a really nice app. I had it on my phone, which made it really quick and easy that if there was like a situation where we're discussing a patient, we really can't figure out what's going on, I could just pop this out real quick, look it up, and give off, other differentials that are presenting very similar to what we think is going on, just in case we're missing anything. The last one that I thought was really helpful was MDCalc, protocols that require scoring, and this thing, MDCalc, just covers all that. So like the Wells criteria, it's really quick and easy. Sometimes, you don't remember like exactly what gets a point or what doesn't give a point. So it's helpful to just have that little app open and you can just score it as you're talking to the patient. So that's, in a nutshell, the apps that I thought were the most effective for me. There's a lot others, obviously. If you're in a specific specialty like peds or OBGYN, they have their own resources that are really helpful. But I felt like those 3 kind of go across the board in any of the specialties that you're in, especially UpToDate. That one for sure. All right, guys, I wish you the best of luck and keep kicking butt.